going to help me do the bunny hop.
Oh, I can't do that.
In your chair, we're going to do the bunny hop. Of course you can do the bunny hop. You go one back.
If you were living out your life in one of most long-term care institutions, you also might forget that you could dance, sing, laugh, tell stories, and matter to your friends.
I think it should be the wheelchair bunny hop. So you have to be on wheels. It's bunnies on wheels.
The Dancing Heart, Vital Elders Moving in Community, created by Maria Janae at Kairos Dance Theater in Minnesota, is a pioneering, national award-winning, evidence-based dance, theater, music, and story arts program. It is transforming life and lives of elders, their families and caregivers in long-term care, memory care, and other health and community settings, improving quality of life, reducing healthcare costs, building community, and increasing joy and satisfaction.
We've revamped everything. It's elevated the level of activity that you want to provide for people, and we're just taking everybody along with us.
And maybe even more importantly than the cost factor, has a significant impact on improving and enhancing the quality of life. Not necessarily the quality of care, although that indeed would come with it, but the quality of life.
Fall, skin, nutrition and hydration, preventing contractures. Those are the sorts of things that people are showing changes here.
A lot of these residents, they've helped me be more relaxed and believe in myself. So it's building a trust and a community.
I'm getting limbered up a little. I walk better than I did, much better. I think Dancing Hearts is good for us. We get acquainted, and we talk and we laugh and we sing, and that's good for everybody. I think we get a little more graceful.
You may be surprised that the arts are just a cost-effective, efficient, inspiring way to save money.
So we saw improvement in overall health, fewer doctor visits, less medication use, improvement in terms of mental health measures, and improvement in terms of social activities. And then there was this sense of people feeling, gee, I had no idea I could be so good.
And the Dancing Heart is a perfect example of one of those programs.
We start with the belief that people of all ages, abilities, and backgrounds, dancing together to music we care about, and from cultural and personal stories, is beautiful and makes compelling art. We encourage participants to be vitally engaged with integrity as full collaborators in a creative process based in the content of their own lives, with safety, dignity, respect, and fun. Then personal, family, and organizational transformation can happen as relationships and community are created through these shared experiences. Bring this artistic drama and community-building expertise into collaboration with professionals in healthcare settings, and then scientifically measurable, research-based health and quality of life benefits occur. We start small and value everyone and everything.
And we move beside our shoulders. I like Jean's got a little shoulder roll going. So should we just try, move your shoulders a little bit? And just elbow.
Breathing in, breathing out. Breathing in, breathing out.
I want you to stretch as far as you can from your center. That's it, Myrtle. Myrtle's stretching her foot too. And if you can, stretch both. You could do an arm too.
Personal stories and the storyteller matter.
So did you listen on the party line? No? Not you, Grace. Oh, never listened on the party line?
Well, sure I do.
The truth comes out. The shit comes out. Yeah.
I knew exactly who was calling who when.
My gosh, you are beautiful.
Yeah, he's a wonderful man.
You
We'll
are
all see that she's beautiful too.
You are beautiful.
Personal reminiscences and stories go into group poems, songs, and dances.
He came from Ireland.
With imagination and courage, we might risk moving a finger.
Angie's got a finger tapping. You can tap anything you want, really. Here you go, Sylvia.
Soon, we might do some easy chair dancing.
Okay, we're going to go around the circle. Now we're going to follow Rose. We follow Rose. She's dancing with her shoulders and her spine.
But who wants to miss out on Turkey in the Straw?
We're going to roll them up and twist them up, a high tuck-a-ha, and hit them up a two-toe turkey in the straw.
Or social dancing, almost like we remember it.
You ready? Nope. I'm tired. Yeah. Alan, where does the umpire go? You decide. Our batter.
We even go to the ball game. Better yet, we're in the ball game.
Come on, let's get some noise from the outfield here, please. Okay, you ready? Are you ready, Loretta? Okay, here comes drum roll. Here's your bat. Here's your bat. Okay, watch Bonnie. She's going to throw you one. And... Wait, Loretta.
Residents, caregivers, visiting family members, and volunteers are all involved in joyful, vital, collaborative, immersion art-making experiences. These maximize cognitive, physical, and emotional functioning, improving strength, flexibility, energy, balance, memory, socialization, and overall health.
Now, it's hard to explain. It's just a feeling of being together. They just make you feel at home, and they don't push us at all. If we aren't able to do something, we don't have to. We can just sit there like a bump on a log, and they don't say a word. But if we want to get into the action, we can.
When you're looking to bring in a professional artist to a facility, you're looking for a very special type of artist. Building community is part of how they see their art form. In fact, it is their art form.
How can I help to invite a community to grow and become a collaborative, creative, joyful community?
I like to think of the Dancing Heart as the gift of freedom.
You know, I think there's just this once-a-week event where they're together and they're sharing their stories, they're experiencing a creative process, there's some chaos and fun, and I assume that it creates a bonding.
There was a bewilderment at the very beginning. We didn't know what we were getting into. Now we know we're going to be going in and acting silly, and we know that other people don't care. So that's great. So I enjoy sitting around with a bunch of long faces all the time.
Research by Dr. Gene Cohen at George Washington University and others shows that elders who vitally engage in professionally led arts programs like the Dancing Heart live longer, go to doctors less, take less medications, fall less, and have better overall health.
This is part of the power of the Christmas Carol with Ebenezer Scrooge. When the ghosts came in and applied creative dream work and imaging techniques, these were art techniques that helped Scrooge free up these emotions, deal with this chronic depression that had been missed.
And Einstein College researchers found that dancing is literally at the top of the list of leisure activities that appear to play a part in delaying the onset of Alzheimer's disease.
Dance has so much going for it. Howard Gardner in the field of education has talked about multiple intelligences, that some are visual learners, some are verbal learners, some are kinesthetic learners. In dance, I mean, you have all of those elements.
During a 3-year collaboration with the Wilder Foundation Adult Day Memory Care Program and forward-thinking funders, evaluations showed the Dancing Heart helped 43% of participants improve functional strength, endurance, and balance. Anecdotally, we observed increased sociability and participation, and sustained cognitive functioning. And the Wilder program may never be the same.
When he was first diagnosed, his neurologist told me that he would probably have 10 years to live. And I was just bleak. It was bleak. It's almost 10 years and he is still walking, talking, eating by himself. He's stimulated here. He's encouraged to do things. At home, if he was sitting at home, he'd be in front of the TV and he'd be in a nursing home today. I swear by it. He is worth it. He's worth keeping around for a while longer, and I think Dancing Hearts helps that.
What I have seen is that people have maintained at a higher level based on whatever level they were when they came into the program, and they haven't declined as fast as I really think without this kind of stimulation and so forth, they would have. And when we're talking a 3-year maintenance, we've been able to keep people not declining, and that's huge. What we do see is that following the group, people's verbalization and their socialization increases. There's more ease in the setting. It carries over into what the next thing that they're doing, and for some it carries over for the full day. You know what? The sky's the limit. We don't know what people are capable of, but we need to encourage that. We need to provide an environment that allows for creativity.
In a 2-year collaboration with the Ebenezer Foundation, supported by Medicaid funds through the state of Minnesota, the Dancing Heart is seeking innovative ways to improve long-term care and reduce costs. Along with curriculum development and staff training, we are creating a best practice model for further sustainment, replication, and diffusion.
She
commands respect.
She does. She does. Yeah, she does. Someone had said this. We were talking about the projection. You know, what you imagine older people, older adults to be, because obviously they can be very collaborative. They can be very creative. They can be imaginative and artistic. But I want to say that our culture does not usually think of older adults being all those things.
There's a cultural synergy that happens, and the unexpected and very fresh and very creative things happen that go beyond anything we could plan. At mid-project, the preliminary results are affirming. Using sit-stand and mini-mental assessments, we see marked improvements in balance and muscle tone and improved memory. Plus, anecdotally, we observe significantly improved self-confidence, enthusiasm, and staff satisfaction.
I think that we lose the real benefit if we're just looking at this as a means of entertainment or something that just kills some time, because it's a much bigger piece than that. You observe how that spark has been relit, and to see that happen in somebody that you care about is very moving.
It's taken some time, like 12 weeks, to be able to just try to see really what it is we are doing. But then when we started probably about a month ago really seeing different significant changes with people outside of the room, and it was from feedback from nurses, it was feedback from other staff. Those are the kinds of things that are measurable.
I love to dance.
We were honored to receive the 2007 Award for Excellence in Program Innovation from the Archstone Foundation and the Gerontological Health Section of the American Public Health Association, and one of the 2008 Mind Alert Awards from the American Society on Aging, in collaboration with MetLife Foundation. The Dancing Heart is included as a best practice program both in the National Guild of Community Schools of the Arts, Creativity Matters, the Arts and Aging Toolkit, and in the National Endowment for the Arts, Office of Accessibility, Arts and Aging Resource List.
You're never too old to dance. At least that's what Maria Genet believes.
We appreciate the press attention. Our vision is to continue to work with forward-thinking community artists, healthcare professionals, funders, volunteers, and individuals and their families to effect sustainable culture change and support lifelong learning. Because the best way to save money also might be the best way to live. Dancing.
Our programs, our arts programs, have been a centerpiece for bringing in new families and clients to be able to see the rich life that can be lived at a long-term care facility.
If you have people who are visiting the place and they see people with a smile on their face who are dancing, who are singing, who are drumming, who are drawing, this is very, very powerful. This is home at an elevated level.
Good story.